Government is reportedly poised to ban, Paul's talking about these single-use vapes.
Yes, this is after a series of calls from councils, leading paediatricians and public waste campaigners to make selling the disposable devices illegal on health and environmental grounds.
Well, the government is concerned that the products are being overwhelmingly pitched at kids, though, who then become addicted or move on to cigarettes or whatever. So should vaping be banned? That's basically what we're saying.
Well, joining us to discuss this morning is Professor Sherif Sultan from the International Society for Vascular Surgery, who, as you might expect, thinks that vaping should be banned.
And Marina Murphy, who joins us here in the studio from the
nicotine delivery systems, or alternative nicotine delivery.
So basically, you would be pro-vaping, Marina, and you see banning as not the solution. How can we get round this? Where is the problem, and why do you think vaping is not necessarily a harmful thing?
Well, e-cigarettes are designed for smokers, so designed to help smokers stop smoking, and I think it's very important for them to have the e-cigarette that
But if they're ending up in the hands of kids, we've got a problem straight away.
Yes, and they shouldn't end up in the hands of kids because they're not designed for children. They're adult products, they're age-gated, and nobody should be selling them to children. But I don't think the solution to youth access is to take an adult product out of the hands of the adults who want or need to use them.
But they're not safe. I mean, a lot of people think that these are perfectly safe alternatives to cigarettes. But Professor Sherif Sultan, you're saying that one vape is equivalent to 50 cigarettes?
Yeah, exactly. So if you have 2 or 3 mils in a cartridge, this is equivalent to almost about 60 cigarettes of combustion cigarette. So the whole idea that we're going to say that it's a reduced harm using e-cigarette doesn't make any sense at all. Harm-free have to be, not reduced harm. As if you're saying that a heart attack is less severe than a cancer. We cannot play with words like this. And we have to understand fully that electric cigarette causes combustion of some sort of a liquid that goes in, and it contains formaldehyde. It's 15-fold increase in risk of cancer over 5 years. And moreover than that, the byproducts that some of them we are not aware of, like acetaldehyde, acrolein, and diacetyl, all of them causing problems, including popcorn lung, which is impossible to treat.
Okay,
So
well, the long and the short, Marina, is the professor is saying that vaping is the youth catastrophe of the century. What is going wrong then?
Well, I want to address a few points that the professor has just made. An e-cigarette in this country has 2 mils of 20 milligrams tops nicotine, so that's 40 milligrams tops. A packet of 20 cigarettes can have up to 200 milligrams of nicotine. And the issue with cigarettes is not the nicotine. The nicotine is not causing the problem. It doesn't cause cancer. I mean, you can look at Cancer Research UK's website and it'll tell you that. You don't have to listen to me, but they will tell you it's not the nicotine, it's the toxicants in the smoke that causes all the problems. And e-cigarettes don't burn anything. There's no combustion. And there is no evidence at all that e-cigarettes cause cancer.
What about the environmental consequences as well? All these plastic depositories left all over the place and ending up in the water and things. There must be, even if you accept that you still keep selling them, there must be a different way of marketing or packaging them.
Well, disposable e-cigarettes are actually very recyclable, and we've tested our own e-cigarettes. Our e-cigarette in our company is made from cardboard, and it's very recyclable. I think the issue is that a lot of consumers don't understand that these products are recyclable, and they literally think of them as disposable and just dispose of them and throw them away. So that's one issue. I think consumers aren't necessarily aware of how recyclable these products are, and also the infrastructure isn't there necessarily to facilitate them, to help them to do it easily.
I just think we ought to give a final thought to the professor in all of this. People at home, if they have to make up their minds, just give us the case of, why you're saying this. You don't have any vested interest in these vapes at all. Presumably the ANDS does have a vested interest in that. What's your summary to all of this?
Isabel, you have already nailed the head. So there's conflict of interest, and a lot of publication coming in from guys like myself shows there is huge amount of dangers from vaping, and I've published that extensively. I have patients lost their legs, I have patients lost their kidneys, I have patients had clots in the lung because they're vaping. So I'm talking about real world experience. Now, the conflict of interest coming in that when we assess it, 95% of people who have no conflict of interest have shown harm from vaping. However, 8% of people working for the industry have shown harm. That's a 66-fold increase of bad research and bad medicine. So what I'm saying in here that vaping is dangerous, they're affecting the currency of our future with STIOS. It have to be banned. Look what Australia have done. You are not allowed to get vaping except by a doctor prescription. Look at what New Zealand have done. They have banned anybody post 2001 born, not allowed to buy any smoking, whatever it is. So the complacency of the government trying to say, oh, it's recirculation of it and the green part
Okay,
of it.
Professor, we get that. Unfortunately, we're out of time. Thank you, Professor Sheriff Sultan and Marina Murphy from Senior Director, Scientific and Medical Affairs at ANDS. Thank you both very much indeed.